So generally, overall in the world population, about 1 in 5 people will have some type of arthritis. So that's like almost 20% will get arthritis at some point of their life. So if you don't have an autoimmune is less common. So the osteoarthritis, especially with the aging population, we see more of the wear and tear type of arthritis. So it's actually quite a high number of people, and it leads to a lot of disability, a lot of lost days at work, a lot of economic burden on society. So, people get disabled. It's a lot of burden on society.
Of course.
So we try to kind of
all these tests.
I retired. I mean, obviously, but thankfully.
Welcome back. This is Tell Me Why, your Gulf News original podcast. We are a weekly podcast, and as always and as promised, we always bring you the topics that people seldom talk about or seldom address. And today we're talking about arthritis, bone health, and we're talking about misdiagnoses. We're talking about misconceptions about arthritis, and we're talking about prevention methods. With me in the studio is Dr. Humeira Badsha, who is a consultant rheumatologist.
Right.
Rheumatologist. We were just speaking about that. I don't think a lot of people know what a rheumatologist is or does.
Not many people know what or who is a rheumatologist.
Yes.
So they're like, what's a rheumatologist? I'm like, who is a rheumatologist? So we take care of bone and joint problems, arthritis. So we're not orthopedic doctors. And many people, when they have a bone and joint or an arthritis or joint issue, get to see an orthopedic surgeon who's a surgeon, and basically they need to operate on you or do a surgical intervention. But we as rheumatologists, we take care of arthritis. There are 50 types of arthritis, but we also take care of autoimmune diseases. So our specialty is really autoimmune types of arthritis.
Wow. 50 types? 50?
50, right.
That's insane. I never
At
knew
least
that.
50.
Wow, at least. Okay, so to begin, since, we're taking baby steps and we're trying to explain it, I mean, to me as well, because I'm here to learn, what is arthritis?
So arthritis is basically anything which affects a joint.
Okay.
And did you know there are 200 joints in your body?
No, I had no idea.
Starting from, there are fixed joints in the scalp and the skull, and then you have your jaw, so there are many joints in the body. There are 200 joints. So anything which affects a joint with pain or inflammation or swelling is arthritis. So there are two main categories of this. Now, your grandmother would have arthritis. Her bone cartilage has worn off. The cushion between the bone wears off. That's the wear and tear, degenerative arthritis. And that's called osteoarthritis.
Which comes by time.
By age and maybe even excess use. Like people who have been very heavy athletes with high impact sports, they could get arthritis at an early age, or if they had an injury to their cartilage, they can get it at an earlier age.
Right.
But other types of arthritis are mostly autoimmune. And then there's a third category, which is gout, which is due to a high uric acid in the blood.
Right.
So that's the third one. But most of the middle category is autoimmune, such as rheumatoid arthritis, lupus, ankylosing spondylitis, and other autoimmune conditions, scleroderma, etc. So there are many in that category.
Wow, it seems like we're going to be here all day because I feel like you said so much, and we need to explain those. So let's begin with what causes. We're going to talk about the autoimmune aspect of arthritis.
Right.
Yeah.
So because we know that we already spoke about osteoarthritis, which is the wear and tear that's caused by age and by injury. So the autoimmune arthritis is a part of autoimmune diseases. There are many types of autoimmune diseases. So where your immune system for some reason turns on itself, there is a genetic component and an environmental trigger. So you've heard of little kids getting diabetes, for instance. Those are juvenile diabetes patients.
Yes.
And that's because their immune systems attack their pancreas and doesn't produce insulin anymore. So similarly, in arthritis, the immune system attacks the joints.
Okay.
So there is a genetic predisposition. We've done studies and we've found different genes which are responsible. And then there's something which triggers it. So the trigger can be a virus or bacteria and infection. So we saw a lot of post-COVID triggered rheumatoid arthritis, for instance.
Oh, interesting.
Yes. And then we see injuries. Sometimes we see just a stressful event can trigger it. So it's something like there's a pile of wood, dry wood, and a matchstick which lights the fire. And then the immune system is chronically active when it should not be. It's like the policemen have been let out of the police station and they're attacking your own body. They don't go back into the police station. So it's a constant attack.
Okay. And in terms of prevention, can someone actually prevent getting rheumatoid arthritis even if they are genetically predisposed?
So, if you're genetically predisposed and carry the gene, you may not get it if you didn't have that environmental trigger. If you didn't get that particular virus or bacteria, or that particular stress, or
Okay.
you may not get it. But how do we prevent getting it? Is generally being healthy. So
Okay.
we know a lot now about the gut microbiome. We have trillions of bacteria in our intestine, and these protect your immune system and promote a healthy environment. So even if you get that infection or that trigger, your gut bacteria may protect your whole microbiome. It's not just in your intestine, actually. It's
Yeah.
starting from your mouth
Your mouth,
downwards. So your microbiome may protect you. Secondly, there's things like vitamin D. We think it's only for healthy bone and joint, but it's really important for the immune system. So
Okay.
again, going back to COVID, we found that people who had good vitamin D levels did better with COVID. And so it also protects the immune system. We find people with autoimmune diseases do better when their vitamin D levels are good.
That's fascinating. I mean, I want to go back to that COVID point. Is there a correlation? Like, why was there a rise?
Because they're different viruses. This is that we saw a lot
Okay.
of COVID at one time. So we saw a lot of these COVID-induced arthritis. But there is so many other viruses. I don't want to name them, but they're parvovirus, Epstein-Barr. There are different types of viruses which can trigger arthritis,
Okay.
and we know that.
Okay. So in terms of treatment and recovery, can people actually be cured from arthritis, or is it a lifelong?
Yeah, so there are certain types which can be cured. There's one particular one called reactive arthritis, where you have a particular bacteria, then you get sick, you get a lot of joint swelling and inflammation. It can last anywhere from 3 weeks to 3 months or more, and then
Okay.
people recover. So that's reactive. Then there is milder forms of rheumatoid arthritis. If caught early and treated early, people can actually be off medication and be cured for a very long time. We call those long-term remissions. It's just like maybe
Wow.
having cancer and catching something early, and you can cure it if it's caught really early.
Okay.
So those can be cured.
And then there is the third, which can be a
Yeah,
lifelong
so there are some
condition.
severe types of rheumatoid which can be lifelong and need to be on long-term medications. And people are always asking, so when can I come off my medication? And I know this cousin went for this treatment and they got
Yeah.
cured, or that
Yeah.
relative told me. So people don't understand that there are some, benefits of certain types of alternative treatments as well, but it depends on the type of arthritis you have.
Yes.
You may not even have arthritis. You may have chronic pain due to a different condition like fibromyalgia.
Right.
And in that case, you might have got cured by an alternative medicine. But if you have a very inflammatory arthritis, which is autoimmune, like rheumatoid, it can lead to a high risk of joint damage.
Right.
So the best bet for you is to be diagnosed early by a rheumatologist and to be treated early to get yourself into disease remission and prevent joint damage.
I was just going to say, it's so important to go to the right people or the right person
Right.
to get a specific treatment, because it's
Exactly.
not a one-size-fits-all with anything in the medical field.
Absolutely.
I feel. So that's gold advice.
Yeah.
I just wanted to maybe dig deeper. I have so many questions. Maybe dig deeper into like prevention methods. So like, let's say, I still don't have it, but how can I avoid it then? I mean, you spoke about catching it early and, actually getting cured for life if you catch it early. But then how can I prevent it from happening?
So a few things, as I said, again, our diet and what we put in our diet and what's happening in your gut is very important for your immune
Right.
system. And people really downplay the importance of this. And we're just understanding more and more. We have like now ability to print your gut microbiome and or
Yes.
to actually analyze it and know exactly what kind of composition of bacteria there. So first of all, eating healthy, having a good prebiotic diet, we say, which is lot of fiber, lots of vegetables, green stuff, fruits, getting enough sunshine, vitamin D. I can't emphasize that enough. So creating the right environment in your body and the right mix of good bacteria can prevent you from getting autoimmune disease. The second thing is avoiding stress. It's very hard, but I've seen people when there's a sudden trigger with a stressful event. I saw a woman, I used to work in the United States, and her son was deployed to war. And the very next day, she developed an explosive onset of lupus. Like the stress of him going to war. So these stressful events, so we see that often. An injury also, if you're stressed about an injury. And then there's the chronic stress. There's a stressful event and then there's chronic stress and how you react to it. So managing stress, we all know we have to do that in our day-to-day life, because I think that's such a huge trigger of so many different diseases, from obesity to autoimmune conditions.
Yes.
So it plays a big role. So it's something like asking, how can we prevent cancer? And again, eating healthy, no processed foods, taking care of your microbiome and the good bacteria in your system, and of course, no smoking. Smoking is a big trigger of autoimmune diseases, and I've been talking a lot of other things, but if you're predisposed to it, if you have family history especially, you need to stop smoking.
Avoid that at all costs. I love that you mentioned stress, because it is the number one silent killer. I feel everyone that I've had on the show talking about, psychology, whether it's mental health or physical health or anything of that matter, stress, it always goes back to stress. Like with a lot of these conditions and with a lot of autoimmune diseases comes psychological distress, and comes a lot of it does result in stress as well, which is ironic because we're trying to avoid the stress, so we don't make the condition worse. But what are some of these psychological effects that have on the person from these conditions?
So Maria, as you can imagine, someone is not able to perform their daily activities sometimes. We have people who can't put on their clothes. Those are the extreme cases. But even treated patients may have a flare. They can't walk. Someone may be a football player, can't play the game which they love. They may be a child who has juvenile arthritis and loves football. And yesterday I saw a kid like this. And they can't do it because their ankle is swollen. So it leads to a lot of distress because they can't do things they want to do. And the second thing is they feel like they're putting burden on their family. A lot of women who have this have to ask their husband to open the bottle for them, or to help them with the cooking or chopping, and they feel like they're not fully present or capable of taking care of their families. So we say it's okay to ask for help when you need it. And also, these are temporary disabilities. If you are again treated well, we don't feel like there should be any limitation on you.
Right.
We have rugby players who go back to playing rugby. We have examples of tennis players who won Wimbledon who has rheumatoid arthritis. Venus Williams has an autoimmune disease. So there are many, many people who have autoimmune disease. And so we show them these examples. These are the top tennis player, golf player, and they have autoimmune disease and they're doing it. And you can too. You just need the right treatment. We need to persist. We need to be positive. And you need your support of your family and friends. And we also have these support groups. We have regular programming for people to sit around and chat about what they should eat, how they should exercise. So we do this regularly to support our patients as well.
I agree, because support is crucial. I mean, when any of us gets injured temporarily, we always worry that we're a burden on our loved ones and that they have to be at our calling 24/7 for a short period of time. So I can only imagine what, arthritis patients have to go through. There certainly has to be certain adjustments that need to be made.
Right.
So what are some adjustments that people can make to make their daily routine easier?
So, I don't believe that anyone should be so disabled that they should need to use crutches or or bottle openers. We do try to get them back into full performance and full capability with proper medication and treatment. But there can be adjustments. For instance, you may not be able to climb stairs for some time, or you may be a fall risk because you're not fully balanced. So then you may need to use a walker or crutches for some time. So they can be temporary adjustments, we call them, but I wouldn't like them to be permanent. And I always tell them, sometimes my patient come in a flare in a wheelchair, and I'm like, next time you need to be walking in here. And it's like their goal too. They want to make their doctor happy. And so they work on that too, that they're going to walk in there with the right treatment, the right exercise, and the right encouragement.
Is it true that arthritis as a whole is a condition that only affects older people, or can it also affect younger
No, absolutely not.
audiences?
So you have 50 types, right?
Okay.
So we talked about the one which affects older people. So there's juvenile arthritis, which affects kids. So we have kids who are like 1 year old, 2 years old who have arthritis. And can
Wow,
be
as young as one.
Yes, 2 years old. And they're taking chronic medications, sometimes for their whole lives. Sometimes they grow out of it. Then we have middle-aged people. And then some types of arthritis affect women more, and some types are more common in men. But overall, autoimmune diseases are more common in women.
Okay.
So that's a very interesting area as well, because women, it's the hormonal balance in the women, as well as, I don't know if women have more stress. I'm not sure.
Could be.
Or they stress themselves more.
Could be.
So there's these factors, but definitely age is not a factor. You should not. People often come to me and said, I never thought I would have arthritis, and that's why I never sought this type of treatment or went down this path, because I'm so young.
Right.
I'm only 25. I'm only 22. And, it is quite distressing to get a diagnosis when you're so young. You have your whole life ahead of you and you're being told you have arthritis. I have a 17-year-old girl right now. She needs to go away to college, or she's 18. And she has really bad swollen joints. And, she's amazingly stoic. Young people, especially, are very stoic. They don't. Children also, they're like casual about it. It's just something they grow up with. But like older people, I think we get a bit more anxious and stressed about things. But,
is there a reason why children get it other than being predisposed?
Yeah, it's the genetic factors, and maybe they get a virus again, which triggers
also
it.
the virus. Okay, so it's the same factors
Yes,
as
exactly.
adults. Okay, now we spoke about the prevention, but I actually want to go back to, what do I look out for? Like,
Yes.
what if I don't know I have it and I should be looking out for certain symptoms, certain signs?
So first of all, pain.
Okay.
So
obviously.
pain which is persistent. Obviously, if you have pain for 2 or 3 days, forget about it. But pain which is persistent for more than a couple of weeks. All right?
Okay.
So they can be anywhere. So we can have pain in the small joints of the hands and feet, and that's rheumatoid arthritis. But something which people often neglect is back pain. Young men especially neglecting this chronic back pain, and that's a type of autoimmune arthritis. And they just think, it's because I'm sitting long at the computer. It's
Right.
because I have not exercised. But they don't understand that there is an inflammatory type of arthritis called spondyloarthritis or ankylosing spondylitis, and it can affect young men from the age of 14 onwards. So they sit for long, they get stiff when they sit up, or they find it hard to get out of the chair, or in the morning when they wake up, they have morning stiffness. If you have pain in your back, which is worse with rest, seek the help of a rheumatologist, because that could be arthritis. Then there can be skin conditions like psoriasis, and that with nail changes and maybe something funny in your fingertips, that can be arthritis. Skin tightening, changes in your skin, or rashes, ulcers in the mouth, rapid hair loss, these are all autoimmune types of arthritis like lupus and scleroderma. But pain in a joint with swelling and inflammation and stiffness in the morning, those are the hallmark features.
Is there a case where surgical intervention or procedures are necessary? Are there severe cases?
Absolutely. So if it's an osteoarthritis where there's no cartilage between the bone at all,
Right.
then we say, please go to the orthopedic doctor. There's not much we can do for you. And then some people refuse to do that. They say, I don't want a surgery at any cost. And we try things like injecting oily substance called hyaluronic acid, like fillers,
Yes.
into the knee. That sometimes helps, or steroids, which we don't do anymore, or platelet-rich plasma stem cells. They may help, but if a patient has end-stage arthritis, they need to have surgery.
Okay.
Yeah.
Okay. And what does that require? Like, do they just...
They just make not a little cut, a substantial cut in your knee, and they replace the bone tops. They cover it with metal, and there's a sort of a plastic bit. So,
Wow.
you're just like sort of a bionic person. But it's
Wow.
actually very successful and very easy these days. So I really, when I see patients who need it, I'm not a surgeon, but I encourage them to go to the surgeon, because that's the best thing for them. And they're like 55-year-olds, and they're like, okay, or 60-year-old, and they say, I'm 60 already, I'll live with this knee. And I'm like, actually the lifespan of people is 80 or 90 now.
Yes.
So at this, do you really want this quality of life for yourself for the next 20 or 30 years? These are the best years of your life, maybe.
Yes.
And you need to have the surgery. So they understand then and they go.
Yeah, and it goes back to the point of the lifestyle, as you
Yes.
said. I mean, you change your lifestyle. This could help you,
Yes,
in turn, make you more active,
Exactly.
help you with mobility
Absolutely.
and all those sorts. Okay, so do you have any statistics on how many people? Because I know that rheumatoid arthritis or arthritis as a whole is underdiagnosed, and I think it's misdiagnosed as
Yes,
well. I think a lot of
absolutely.
people get the diagnosis, but they don't necessarily suffer from the condition, and vice versa.
Absolutely.
So do we have any statistics?
Yeah, so generally, overall in the world population, about 1 in 5 people will have some type of arthritis. So that's like almost 20% will get arthritis at some point of their life. So if you don't have an autoimmune is less common. So the osteoarthritis, especially with the aging population, we see more of the wear and tear type of arthritis. So,
Right.
so it's actually quite a high number of people, and it leads to a lot of disability, a lot of lost days at work, a lot of economic burden on society. So,
Yeah.
people get disabled. It's a lot of burden on society.
Of course. Do you see that awareness is increasing, though, in the world?
Absolutely.
Yes.
It is. And in the UAE, we are happy that I've been here 19 years now. So we had set up the Middle East Arthritis Foundation. And so when I first came to the UAE, we found that the delay to diagnosis for rheumatoid arthritis, for instance, was almost 2 years. People were wandering around, not treated. And then after all these awareness campaigns, after the media, after talking to people like yourself who really are increasing awareness, we found that the delay to diagnosis has gone down, delay to treatment has gone down, the acceptance has gone up a lot, and we do regular programming for this.
Love it. Thank you so much. Okay, my last question. I know that you are a busy woman, but what's your advice for people overall?
So overall, besides having a healthy diet, you also need to take care of your bones, because as women age, it goes to osteoporosis. And there's a lot of misconception about calcium. We touched on vitamin D. Vitamin D comes from sunshine, but if you're not getting enough sunlight, you need to make sure you have levels of vitamin D above 30 nanograms, so you need to take a supplement. But calcium supplements, people are really afraid of. They think that these are going to lead to heart attacks or kidney stones, and there's a lot of misconception and myths around calcium supplements. But you really need it for your bone. You need about 1,000 milligrams of calcium per day. And if you're not getting that from your diet, because in your diet, the main foods which give you calcium are dairy products.
Right.
So 1 full cup of milk will have about 300 milligrams of calcium. 1 full cup of yogurt is 300 milligrams. And other great foods are sesame seeds and almonds, but not so much calcium as dairy. So if you don't eat dairy for various reasons, so many people don't eat dairy either because of allergies or lactose intolerance, then you really should take a calcium supplement to make up that deficit. But if you have a diet which is high in dairy, don't take that calcium supplement. But you do need to take care of your bones, because we are aging, we are going to live longer, hopefully, and then we need to not have osteoporosis and break our bones as we grow older.
Amazing. Dr. Badsha, thank you so much. Is there anything else you'd like to add that we may have missed?
Well, get yourself treated. Now you know what a rheumatologist is, or who a rheumatologist is. Yeah,
indeed.
And so get yourself checked soon.
Thank you. Thank you so much.
Thank you
you for your time.